Good morning, Chicago. I'm Dr. Allison Severity, Commissioner at the Chicago Department of Public Health. As always, here on Facebook Live, this is your chance to get your COVID questions answered. Today is Thursday, December 2, 2021. Happy December. Walking over here, it's very warm for December, so I like to see that because it helps people be outside, which cuts the risk of COVID, plus the weather's nice. So as always, we will look at our data here in Chicago, certainly talk. I know we're getting a lot of questions about the Omicron variant. For those of you who weren't on Tuesday, I actually did a big presentation about some of the science behind the new variant. So I would refer you to there if you have some additional questions, but of course we're happy to take them. You can put the questions directly into the box below on Facebook or Twitter. You can also use the hashtag AskDrArwity, and we'll be taking your questions. So let's take a first look at the dashboard. Chi.gov/COVID- is where you are always going to go to see what's happening with COVID numbers in Chicago. So first of all, I just want to note that we have a little comment here at the top. Deaths are likely underreported. There's a data issue right now, just in the last day or two, with the data that's being transferred from the state. And so the team expects that it'll be resolved likely today, and we will correct retrospectively. But just so you know, there's just some sort of glitch in the transfer of data there. But we are averaging right now 457 cases. That's down, but that is, as I talked about on Tuesday, really related to the most likely Thanksgiving, because we see a big drop in testing. It's the same thing that we saw last year. Hospitalizations are at 33. Again, because this is the 7-day average and includes Thanksgiving and the 3 days after, vaccinations are down as well. But I expect those to also pick back up once we're out of the week that includes the Thanksgiving holiday. And testing in the same way down. Positivity is at 3.6%. That's up largely because the testing is down. So nothing really surprising here. I'm going to open up a few slides and just show you what those numbers look like in context for us. So first of all, when we put our numbers into our community transmission and COVID risk matrix, you see that we remain in high transmission with the current daily average of cases at just over 450. That is decreased due to holiday testing. We were over 600, not including the holiday, but we do remain in that high transmission state. Our test positivity remains quite good at 3.6%, even though that's up. We're doing a lot of testing here. We have a lot of capacity, and I've been pleased to see that remain, that's really a sign that there is good testing happening. In terms of our hospital beds, so we are now averaging 324 people hospitalized with COVID here in Chicago on any given day, and that is in the substantial risk or the substantial transmission range, and that's 324 not in the ICU, and then there's an additional average of 94 people in Chicago hospitals with COVID in the ICU, and both of those do continue to increase. As I noted, with the current average case rate, it's down from 613 or 617 at the peak, and you see that a year ago, last Thanksgiving, it's this blue circle. We saw the same thing. You see a significant drop and then an increase, and some of that is due to almost the inevitable increase that comes after people have gathered and traveled and done a lot of the fun things that we do for Thanksgiving, and some of it is also because people typically are not doing as much testing. Some of the facilities are closed, et cetera, for that weekend, and so we saw this last Thanksgiving. As you can see, we've seen a drop here, and I would expect that in the next week or so we'll start to see that come back up again, but we'll see. And then similarly, we see that a similar pattern over Christmas last year. So we continue to see an increase of 5 to 11-year-olds getting vaccinated. This weekend marks second doses for many, many, many kids. This is 3 weeks from our Protect Your Health on the 12th, when we had by far the most vaccines that we have done on a given day in months and months and months here. And more than 20,000, got a lot of kids their first doses, and those kids, many will be getting their second doses this weekend. So you can see that we're up to almost 24%, so nearly 1 in 4 5 to 11-year-olds in Chicago have had their first dose, and we're up to 3% now have had their second dose. And I do expect, as always, that will continue to lag by about 3 weeks, as we would expect. Also, just of note, we actually our 12 to 17-year-olds and our 18 to 29-year-olds, you can see in terms of the first dose on the left here, are really pretty similar at about 69%, and they're really similar to the rate of people over 80, which is what I'm especially concerned about. Again, people in their 50s most likely to be vaccinated and have it reported, but it's been good to see, some catch up there. It's in the 12 to 17-year-olds to the 18 to 29-year-olds, but both of them are lower than really they should be. So as I'm sure you heard, the first confirmed case of the Omicron variant was detected in the U.S. yesterday, just as we expected. The second was actually detected in Minnesota this morning. None of that is a surprise. So the departments of public health are the ones who announced this. And in the case of California, it was a traveler who had recently returned from South Africa. In the case of the one in Minnesota, it was a case in someone who actually had recently returned, not from South Africa or internationally, but who had returned from New York City. And in New York had been at some large events and done, potentially interacted with a lot of people, but had not traveled internationally. And so, again, this is not a surprise, and we have good systems in place to be monitoring for this. I'm not worried about our ability to pick it up. There will be extra case investigation and contact tracing, of course, around these cases. But the real question is going to be over these next couple of weeks as the studies are getting done and we're seeing what spread looks like and looking to see how severely people may be getting infected. Is there a decreased efficacy of the vaccine, et cetera? And so it really emphasizes the need for vaccination, for getting boosted, and then the general prevention strategies to protect against COVID. Some of you saw yesterday on our social media, our team put together the variant villains and did some explanation of this, and I like this. So these are, at this point, the only variants of concern that have been named. We've had plenty of variants that we were monitoring. We've had plenty of variants of interest, but there are now 5 variants of concern. Delta, on the right there, is the one that is by far, it's still 99.9% of our cases here in Chicago, across Illinois, even in the U.S. And the Omicron was named a variant of concern. And the question is, will the Omicron become the next level, the variant of high consequence? And so just as a reminder, variants are normal in every virus. As COVID is spreading, it will mutate, but then some mutations are scarier than others because, for example, they can make the virus spread more easily or they can cause more severe disease. So we are definitely still learning about what makes Omicron different from the rest. The WHO defined it as a variant of concern, like Delta, and scientists the world over, including right here in Chicago, are studying this new variant. Just as a reminder, where we're talking about SARS variants, the lowest level is just a variant being monitored. The variant of interest means that there are some genetic markers in it that suggest it could be a problem, and we're keeping an eye on it. A variant of concern means that we know there's a problem with this variant. It's causing more severe illness, it's letting the virus spread more easily, or there's something else concerning about it, and it's actively spreading in the US. So technically, Omicron has only been named a variant of concern by the WHO at this point. When we are seeing spread in the U.S., it will be named a variant of concern at the CDC. But there's both sort of the world level of this and then the national level of this. And then finally, a variant of high consequence. We have not had any variants of high consequence yet, but that's where we see really clearly that there are public health measures that are significantly less effective than they were. So vaccines are working much less well, or tests are working much less well, or treatments are working much less well, and it's a big deal. So the biggest question for me is, will Omicron end up being named a variant of high consequence? And we will know that probably in the next few weeks. So how can you help stop these variant villains? Getting vaccinated and getting boosted remains the best way to protect yourself from infection, hospitalization, and death. And then also, it gives the variants fewer opportunities to change and grow more powerful. So this is part of why vaccination is not just for you and your family. It is also to actually help the world in terms of limiting the emergence and the spread of these variants. So if folks have further questions about any of that, please do ask them. I like to really explain what's happening with these because I think there is people have a lot of very good questions about them. So go ahead and put those in. In terms of where to get your child vaccine, there are about 200 locations across Chicago. This Saturday and Sunday will be at Richard J. Daley College, 9 to 2, and Wilbur Wright College, 9 to 2. And next week, we will be expanding for the first time to 7-day operations for our Protect Chicago at Home. So starting the weekend of December 11th, we're moving some of our resources from a lot of these community-based clinics, where we obviously are continuing into January, the large ones at City College. But in terms of the smaller community-based vaccination events, we've really had other partners pick most of those up. And where we're seeing the best pickup, especially in highly under-vaccinated areas, remains with Protect Chicago at Home. And so we're moving some resources to be able to expand those operations. And you can call and make an appointment. So to get a vaccine or to get a booster, or if you have questions, visit chi.gov/COVIDVax, or as always, call 312-746-4835. 7 days a week, we've got folks there who will help sort out whatever issue you're having related to vaccine access, vaccine questions, and that is what I wanted to share. So let's go ahead and turn into your questions. All right. Hello on Twitter says, has anyone with a booster contracted Omicron that we know of? That's a good question. This is some of what the scientists are looking at right now in terms of not just the genetic investigation, but a lot of this epidemiologic investigation. What I can tell you is there are already some case studies that are emerging of people who have been infected with Omicron that suggest that the boosters are potentially pretty important. So I was reading one just this morning. There's a doctor in Israel who was infected with the Omicron variant, and he was fully vaccinated, but I don't believe he was boosted. We'll check. This is where you want to sort of get the official reports. But the point is, he had a lot of contact with people during the time that he was potentially infectious. He had been at a large conference. He had been seeing patients. He had been riding in cars with people. And the good news is that at least at this point, after a lot of pretty aggressive case investigation and contact tracing, the huge majority of those people who had been boosted did not actually end up getting COVID, getting the Omicron variant from him. There was at least one transmission, so we know he was infectious, but that was someone who was older and who he rode for a lot of hours very close together in a car with, and I don't believe had a booster. But these are exactly the kinds of questions that really you want to look at, not just as one-off examples, but really look at systematically. I think the preliminary evidence suggests that boosters really do quite a lot to bring your antibody levels back up high, and that is important, even if the match is not as good as it was against a new variant, that having the higher level, because it's not all about antibodies. There's the antibodies as well as your T cells. There's different ways that your immune system sort of learns to fight off COVID. And so one of the reasons that there has been kind of a doubling down on the booster strategy is that in the context of a potentially emerging new variant and a lot of people who still haven't had those first or second doses of vaccine, for people who want to be the best protected, getting that booster is increasingly important in that context. And so I very strongly encourage first, most important is anybody who has not had a vaccine, like now is the time, please, to get that vaccine. But for people who are vaccinated, I'll remind you that all adults over the age of 18 are eligible and recommended to get a booster. You should get it 6 months after completing your Pfizer or Moderna series, and you should get it 2 months after that first dose of J&J. It is not a requirement from a public health standpoint. You don't have to get it to meet a work requirement or to get into a theater or a show or anything like that, but it is recommended to help protect you while we are in a surge from Delta, and particularly with this Omicron variant here. The other thing someone's asking about, sort of Minnesota specifically, Michigan, Minnesota, and Wisconsin right now are leading the country, unfortunately, in terms of COVID cases. What do those states have in common? They tend to get cold fast and early, and people move inside. What else do they have in common? They're all sort of just north of us. And I am not surprised to be seeing some surging COVID with the cold weather. We've been saying that all along. And where people are vaccinated and boosted, that is by far the most important thing in terms of protection. But we will definitely, as some of the studies are actually getting published around what are they seeing in South Africa related to breakthroughs, related to people, because it's not just that they're seeing breakthroughs of people who have had a vaccine, it's that they're seeing a lot of people who had COVID in the past, and quote unquote, had some natural immunity. That doesn't seem to be holding. And so that's where, the combination of the booster and the vaccine and natural immunity, that's what I'm interested in. What's the protection like there? But we will definitely be sharing with you as that information is coming out just over the next, few days to weeks. Matt Robertson on Facebook has a couple of questions here, asking, with the new variant, will there be restrictions put in place again? And what can be done about those that refuse to mask up in stores, creating uncomfortable environments for workers and other customers? Yeah, these are both good questions. So, first of all, there are not plans right now to put additional quote restrictions in place when you think about the kinds of things that we needed to do more than a year ago, particularly before vaccines were available, because with a widely available, free, and highly effective vaccine, there is the ability for people to protect themselves much better than previously. And I don't expect to see the really major surges majorly threatening the healthcare system. Winter is not a good time to be having a surge at all from COVID, even though it's not unexpected, because this is when a lot of our other diseases surge. This is when influenza is on the rise. And yes, influenza is on the rise, and we've had some significant influenza outbreaks already, including here in Chicago. And the problem is that it is a time of kind of stress for the healthcare system at baseline, and having a potential surge of COVID on top of that is certainly of some concern. There are hospitals in Michigan and Minnesota, I'm not sure about Wisconsin, but I know in those two that are full, that have had to call in sort of the national help and have canceled all their elective procedures. Like it's happening. And so we don't have any plans for restrictions. It's possible there could be some additional settings where you might see more settings that require vaccination. For example, right now at pretty much all of the Chicago theaters, or nearly all of them, you have to show your vaccine card and your identification to get in. Certainly we've seen events doing that, and as we've been giving advice as the health department, events, of course, large events are worried and should be worried with where our cases are and where, with this new variant there, very much encouraging them to require proof of vaccination. And if not proof of vaccination, a negative test, really in many cases, but even a negative test, I'm not loving right at the moment with this. We're encouraging vaccination. So what can be done about those that refuse to mask up in stores? So, this is interesting. Internationally, people mask so much better than we do in the U.S. It's actually really remarkable, as I have looked more into this and learned more about it, even in places that have record low numbers of COVID cases and much higher vaccination rates than we do here in Chicago or in the US, masking is universal, really, without question. Indoors, and actually in many countries still outdoors, all ages. And, I've had a chance to even, see some of this and talk to people who are living there. And it comes down to the fact that I think in a lot of countries, especially countries that have more challenge maybe getting the vaccine, maybe are not as wealthy, do not have social safety net in place, don't have all of the internet availability to be able to, for example, have the children go to remote school, that there really is not an option except to take COVID seriously. So, for example, in Mexico City, they have a very, very high rate of adult vaccination. Like over, 94% are fully vaccinated of the adults, but they still haven't had enough vaccine to be able to do teenagers or children or certainly boosters. And outside of the city, there's not been enough vaccine to vaccinate in rural areas. But despite a very high vaccination rate, they are also masking at all times. Indoors, outdoors, all ages. And when you talk to people there, or you're checking in, with the health folks, what they've said is that the issue is that in a country like Mexico, yes, there were some of the big shutdowns early on, just like there were all over the world, for a month or two, but there wasn't enough of a social safety net, and people literally were going to starve, or their children were not going to go to school. There's a lot of informal economy there. And so really the decision was made to be serious about COVID, because wearing the masks, doing the hand sanitizer everywhere, staying home if you're sick, and then once the vaccine was available, of course, taking the vaccine has really been the approach, because it's just interesting. Like when I'm talking to folks and they're like, well, I don't understand why I wouldn't wear a mask. Like, we're in a global pandemic. And so I think here, the federal government has just extended, to nobody's surprise, the requirement for masking on public transportation. And the state and the city, as you know, continue to have the indoor masking requirement because we are at high risk, even outside of the Omicron variant. And, if and when those numbers come down, we would, of course, drop that. We have to see what happens with the Omicron variant, but I am hopeful. And the Business Affairs and Consumer Protection Department, by the way, does continue to enforce the mask requirement. So if you are in a setting here in Chicago that you think is not being serious about masks, you should let us know through 311. And there continue to be businesses that are fined for this, investigated. And really, I hope, though, most people, like in Mexico, there's a lot of pressure. Like, if everybody around you is wearing a mask, you start to feel out of place, actually, if you're not. These masks are not forever, but they are part of what help us stay open, not put those other restrictions in place. And that's what I want to do. I want us to not have to worry about COVID so much. And if masks, as we know they are a part of that solution, they're not as good as vaccine, but they help. Then while we remain at high risk, they will remain in place. And I wonder a little bit with the emergence of the variant whether people might get more serious again about if there are some settings where masking is not happening as well. And certainly we're seeing more interest in COVID boosters, which is good because we need to see that. Clifton Patterson on Facebook: should teenagers get the booster now, or should they wait for a potential Omicron vaccine? So teenagers are not younger teenagers are not eligible for a booster yet. Right now, the only people eligible for a booster are people age 18 and over. I think it is quite likely that we may see 16 and 17-year-olds approved for the Pfizer booster, authorized for the Pfizer booster from the FDA. the CDC would have to sign off. But the reason for that is because if you remember, the very original trials for Pfizer, which was the first vaccine here, actually went down to the age of 16. So when we started vaccinating people 16 and up with Pfizer, and then the other two became 18 and up. And so there actually is data. There's long-term data because they've been doing follow-up, and of course, there continue to be no safety concerns, but they've also been looking at efficacy and seeing whether antibodies wane. And so we may see a booster for kids 16 and 17, but for younger kids, there's not a booster yet. But there's also less need for a booster because children were vaccinated later in most cases than adults were. And the other thing is, when I think about risk-benefit, there has been a lot of debate in public health circles around the world. Like, if I had my choice between a vaccine being used as a booster and a vaccine being used as a primary dose, I would choose the primary dose every single time, meaning that, the first dose of vaccine. So if I could snap my fingers and turn every booster into a first dose for everybody in Chicago, of course we would do that. If I could snap my fingers and turn boosters into a first dose for, everybody in Botswana, I would do that too. But we actually don't have the capability to do that. And the last thing I want to see is boosters or any vaccine expire on the shelves here. If you recall, I've talked about before, because it's one of the things I'm actually really proud of here in Chicago. We are, to my knowledge, the only jurisdiction, the only city or state in the United States that actually had the systems in place for vaccine storage, temperature checking, security, paperwork. We have a fantastic system here, thanks to our emergency preparedness program, around everything related to vaccine. We had bought all these ultra cold storage freezers way before people were thinking about them. And in that context, we actually were able to return thousands of unused doses of vaccine from Chicago that were potentially going to expire. We were able to return them federally to be shipped internationally. And it took a lot of work, but I really appreciated the CDC and especially my team here in Chicago being willing to work with us on this, because it was killing me. Some of you know I have worked internationally a lot. I have lived in Botswana and South Africa. I've worked in Uganda multiple times. I've done a lot of medical and public health work internationally, and I remember what it was like here in Chicago when you knew there was a vaccine available, you just didn't have enough of it. And it's been really hurting me to see these thousands of doses expiring on the shelves in the US. It makes me a little bit sick. But once we have distributed vaccine outside of our central warehouse, when it's gone to doctors, when it's gone to pharmacies, et cetera, you cannot recall it just because there's just supply chain requirements. So you've got to make sure that the vaccine has been kept. If you're going to ship it internationally, there are extra requirements. And so I don't want those to get wasted. I want them to go into arms. And where we still have a lot of people who are not vaccinated in Chicago, unfortunately, the risk remains higher than it would otherwise. And so for people who have gotten vaccinated and want more protection, the highest level is the really highest recommendation is for boosters. So Mary Cruz Torres from Facebook says, persons who are not vaccinated are spreading the virus and the virus keeps mutating. Yeah, that's right. So whenever the virus spreads, that's when it has the chance to mutate because it's making millions of copies of itself. And the thing with these variants of concern is that when there is a mutation that makes the virus stronger, that's the one that from an evolution perspective kind of outcompetes the other variants. And so, yeah, it's when basically the more COVID there is in a population, the more spread there is, the fewer people that are vaccinated, the more opportunity there is for virus mutation and for the emergence and spread of variants. So that's why we care not just, obviously I mostly care about protecting people on an individual level. I never want to see people get sick when they don't have to. I never want to see the more than 6,500 people in Chicago who have died from COVID. 99% of those folks just about were unvaccinated. And those are preventable deaths, but on a like humanity level, getting everybody vaccinated is as much about trying to stop the mutation and the spread of variants as it is that individual protection. All right, some more questions about boosters. Let's see. Is it more critical now that individuals get the vaccine booster? Yeah, I think it is. Because first of all, we are definitely seeing more breakthrough infections. Remember that when people are vaccinated with that first and second dose, they are much less likely to get severely ill. And this is what we're seeing over and over again. When I hear about somebody getting a breakthrough COVID case, my first question, if it's a breakthrough case, meaning they're vaccinated, my worry level for them goes way, 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 way down. So, I've had examples of this in my extended family, where, for example, there's a family with a child who is too young to be vaccinated, and that child develops COVID. The parents, the mom is working, taking care of young children. She gets a booster. The father just hasn't quite gotten his booster yet. And in that context, we'd see the father get infected, but not the mom. And we've seen that like multiple times, where clearly the booster does provide an additional level of protection. And so especially, if it's been more than 6 months, I think it's important. And I think with this variant, we're still learning about the vaccine, but it's clear that you continue to get at least some protection and probably, hopefully, pretty good protection from the severe outcomes. So I do think it is more important than it was. Chicago parent says, I heard on the news Pfizer is asking for emergency approval for boosters for older teens. Yeah, right. That's that 16 and 17-year-olds. Do you really think boosters are needed for them and for all adults? I'm on the fence for myself, too, about getting a booster. So, yeah, this gets back to my sort of my comment that the most important thing is for people who have not had any vaccine to get some vaccine. That is clearly the most important thing from a protection standpoint, not just actually for that person, but for all of us. Because when someone is vaccinated, it significantly cuts their risk of getting COVID, which in turn, you can't spread COVID if you don't get COVID. And so it helps really reduce the risk for everybody. But I do think, the younger and healthier somebody is, the less likely it is that they are going to get seriously ill with a breakthrough infection. This is why there's been this debate, with the WHO, et cetera, that countries should be focusing more on getting poorer countries vaccinated than we should on booster shots. And I actually agree with that in terms of, I think, the U.S. has donated the most vaccine of any country, but I think there is more to do there. And that is what we should be doing. But I do recommend at this point, as you've heard me say, very strongly recommend that anybody who's older, anybody who's got any kind of underlying condition, please get yourself a booster. And for everybody else, I recommend it also for whom it's authorized, since we have it and we know it's safe and available, but it is not a requirement. So I hope that helps you think about it, and the protection is clearly better, even with the booster. Latanya McSwine on Facebook is asking, when will the Moderna booster be available? I would expect quite soon. I know that the Moderna booster is available. I don't know what I was thinking there. I was thinking about the kids. Moderna booster is available. Pfizer, Moderna, and J&J boosters are all authorized and available. So if you got Moderna and it's been 6 months, you can and should get a Moderna booster. If you got Pfizer and it's been 6 months, you can and should get Pfizer. If you got J&J and it's been 2 months, I would actually most recommend that you get one of the other two vaccines where you look at the studies. You get your booster with either Pfizer or Moderna, because that's where we saw even higher antibody levels. But if you want to stick with J&J, that's fine. You can get yourself a second J&J dose. Yes, you can get them right now. You can go ahead and get it. You can call our number, 312-746-4835, if you have questions about that. But you can get it through pharmacies, through your doctor's office. It is widely available here in Chicago. Good question. Leonore Chin from Facebook. Hi, Dr. Arwady. How many weeks before the 6 months is it safe? How many weeks before the 6 months is it safe to take a booster? I know people who may be traveling within the 6 months mark, and I want them to be safe. Yeah. So, you know, this gets down to the fact that when we make recommendations, we are making them at the population level. And I am not going to recommend to anybody that they should be trying to use vaccines in any way that is not the way that has been authorized by the FDA or cleared by the CDC. So even if folks are traveling, I don't recommend getting a booster early. If we were to see data that suggested that really before that 6 month mark, there was clearly a need to move that up, then we would do that. But we are balancing here kind of the risk versus the benefit. And remember that still, the biggest priority is making sure that there's vaccine for people around the world who have not yet had that first dose. And so there have not been studies about getting boosted earlier than that, at least not high level ones, and I would recommend sticking with that schedule. So after 2 months, you can and should get a booster if you're an adult and you had J&J, and after 6 months for the other two. And talk to your doctor if you have specific questions. Kanisha Yates from Facebook. How much of a boost does the J&J vaccine booster give? Actually pretty good. So I shared, this was probably about a month ago that I shared on Facebook. There was a big study that was done, it was called the mix and match study, where they actually looked at people who had had the primary dose of either Moderna, Pfizer, or J&J, and then they did sort of all the permutations of that for the booster. And what they saw was that there was not a significant difference. If people had had Moderna or Pfizer initially, it didn't matter a whole lot what their booster was with. And so there was no strong recommendation. But for J&J, remember J&J, still, if people are only going to get one shot, they're like, I'm just doing it once. J&J is very clearly the best vaccine for one shot. So if I've got somebody who's just really scared of it or needle worried, or they say I'm only going to do one, I would much rather somebody have one dose of J&J than one dose of either Moderna or Pfizer. But what we've seen is if you get a second dose of J&J, that booster dose in effect, your protection level goes up very well. It goes up a little higher, though, if you get the Moderna or the Pfizer. And so that's where I said when they did this mix and match study, the only thing that really had a lot of a significantly different antibody level was that J&J followed by either Pfizer or Moderna had a slightly higher level of, had a higher level of protection. It didn't go the other way. If you had Moderna and Pfizer, it wasn't that J&J somehow lifted it up, which had been a hypothesis. But really the more important thing is just that you get a booster. So, you basically, what you're doing there is you're comparing 2 doses against 3, and the 2 doses is holding up very well against the 3, if that makes sense. So J&J remains a good vaccine, but we do want people to get a booster of it. And if it were me, and there wasn't a particular reason you chose J&J, if there was, stick with J&J. If there wasn't a particular reason you chose J&J, it was just the first one you could get, I would recommend either Moderna or Pfizer for the best level of protection for a booster. And Kanisha Yates, a follow-up, why are doctors recommending that people who got the J&J vaccine switch boosters? That's exactly why. And again, the top line is you should get a booster. So if you decided that the J&J vaccine was the one that you wanted to get, and you did well with that, and you feel comfortable with that one, please go ahead and get a J&J booster. Not a problem. But if there wasn't a particular reason in that study, the level of antibody protection after the 2 other boosters was quite a bit higher than it was after the booster of J&J. So that's why, if you're going to do a booster, the thinking is you probably want as much protection as possible. So, but J&J still, it's still a very good vaccine, especially around protecting for the severe outcomes and death, just like the others. Mary Cruz Torres from Facebook. Why do many CDPH points of dispensing give the Pfizer vaccine and not Moderna? So we made a decision, partly from an operational standpoint, to do Pfizer and J&J because For a few reasons. One was that we had a lot more capability than many places did to do the ultra cold vaccine from the beginning. If you, there have now been changes and sort of advancements, and people are no longer needing that really expensive, hard to find level of ultra cold freezer storage, but we did at the beginning. And so the Moderna vaccine was very attractive because you could send it to doctors' offices, you could send it to smaller places, and they could use their regular refrigerators or freezers without needing the ultra cold. And so we made a strategic decision here that we would really use Moderna in settings like long-term care facilities, settings like doctors' offices, and a lot of settings that didn't have all of the infrastructure that we did around our warehouse and our ability to really move vaccine. The other thing, but then we felt like it was important for people to have the choice where people are just wanting to get a single dose and done of vaccine. We really liked J&J and had that as an option. And then, of course, Pfizer is the one that is approved for children. And so recognizing that we want to be able to offer adults and children, and that we're doing a lot of vaccine in those settings, it's kind of a best practice to not try to introduce other factors. It slows things down. And so that's why we do Pfizer and J&J. It's not that we don't like Moderna. It's just that there's not a big difference between Pfizer and Moderna. And we were better set up to handle the Pfizer, and especially with the kids. That's the one we want to double down on. So that's why I personally got Pfizer because I got vaccinated at one of our CDPH clinics, of course. But Moderna is very good too. In fact, the antibody levels even slightly higher with the Moderna. So that's why. All right, we are just about at time. Let me see. Tiffany Hagstrom on Facebook says, how long will it take for us to know more information about the severity of the Omicron variant? I'd say about 2 weeks or so. This is because remember, when somebody gets infected with COVID, you have to kind of see what their clinical course is. You don't know the day that they get infected with a new variant or not how they're going to do. You have to actually have enough time to follow people infected with the new variant to see how sick they get. Do they get hospitalized? Do they die, et cetera? So I would guess within about 2 to 3 weeks, there will be quite a bit more information, both about the tests of the vaccine, about the severity question, about the transmissibility question. And I'll refer you back to Tuesday. I shared a little bit more details about some of that if you're interested. Good question. Okay. So at Supermoon Pics from Twitter says, Doctor, I have a question. I go everywhere in Cook County unmasked and unvaxxed. I often deal with members of the non-Zoom underclass never wearing a mask. I have yet to contract COVID. What would you recommend? I would be really thankful that you have not gotten COVID, and I would get vaccinated. Of course. What would be my other recommendation? I will tell you that we have about 700,000 people right here in Chicago who are like that, who have neither had COVID, so don't have even that level of immunity. If they got COVID and their immune system was able to fight it off, you get that sort of first level of immunity from that, and they're not vaccinated, just like you. 700,000 people is enough people to have a very bad surge of COVID. So it concerns me. I mean, I'm actually really interested that you're on watching this. Thank you for joining. If you are walking around unmasked and unvaccinated, you are endangering yourself from a COVID perspective, and you're endangering others, honestly, from a COVID perspective. So I would ask you to wear your mask when you are indoors, which is a requirement, and it's about thinking about others. That's what that's for. And I don't know if your goal is to contract COVID. I'm not sure what your goal is. But if you don't want to contract COVID, my advice to you would be the same that it would be for everybody else. Please get vaccinated. That's the most important thing. And wear a mask indoors, which is required. Okay, Latanya McSwine, one more follow-up, and I think we're going to be just about done. Will Moderna be available for children? My family has been vaccinated with Moderna and we want to be consistent. I think Moderna will probably be available for children relatively soon, but it's not yet. So, yeah, I mean, I have been strongly recommending always that people get the COVID vaccine that is available to them. Like, if you remember, this has really been the advice all along. The Pfizer vaccine for the children is the one that has been the most tested, and it's the one that has the dose that is 1/3 of the dose that it is for adults. And in a world like we are in right now here in Chicago, where the COVID risk is high, as defined by the CDC, as defined by the state, as defined by the city, even before this variant, I personally would recommend going ahead with the Pfizer vaccine, but I will actually it's a good question. I will take a look and see if I can get any inside information on the timing for Moderna for you. But if it were me, I wouldn't wait. I don't know if your kids are in school, but when your child is vaccinated and they're in school, they also, once they're fully vaccinated, they also don't need to quarantine. If there's a case in school, it's much less disruptive to your life. So we are at time. I want to remind you that we have clinics, COVID clinics, including pediatric clinics at Daly College on Saturday and Wright College on Sunday. Chi.gov/COVIDVax for any additional questions we didn't get to. And I thank you for joining. I'm just trying to see if there was anything else that we weren't here. So we will be back next Tuesday to answer more of your questions, and please do keep sending them in. It's helpful to hear what people are thinking about. So appreciate your time and attention, and please have a good and safe weekend.